Well, once more, welcome to today's to this monthly roundtable with our BOLD program in Oklahoma, successful public health approaches in dementia caregiving. Next slide. My name is Elma Johnson. I am the coordinator of the BOLD Public Health Center of Excellence on Dementia Caregiving. And I also work here at the University of Minnesota as a community outreach coordinator for our Center for Healthy Aging and Innovation. Next slide. Before we begin, we would just like to ground us and acknowledge that the University of Minnesota, Twin Cities, is located on ancestral traditional lands of Indigenous people. And we acknowledge the land itself and the people with gratitude, and take to heart and commit as an organization through action to learn and honor the traditional cultural Dakota values: courage, wisdom, respect, and generosity. Many of you might be already familiar with our center or might have joined some of our past webinars, but just for those of you for whom this is the first time, the mission of our Public Health Center of Excellence is really to support state, tribal, and public health agencies across the country to develop their programming to support family caregivers of people with dementia. So our mission is really to help build public health capacity. And we do that we're as a dissemination center, we do that in multiple ways, by promoting and improving access to evidence-based programs and best practices to support dementia caregivers, by facilitating connections between public health departments and a variety of other partners, also and service organizations who support family caregivers of people with dementia and people living with dementia, and also providing technical assistance and support, tailored support to public health departments to help them select caregiving related goals and help them build partnerships and infrastructure for caregiving in their jurisdiction. If you would like to, I invite you to learn more about our center by scanning this QR code, which will take you to our website. Next slide. And our center is part of the HBI Collaborative, which is a group of partners funded through cooperative agreements with the CDC under the National Healthy Brain Initiative and the BOLD Act. And our collective goal is really to promote brain health, address cognitive impairment, and better support the needs of caregivers. If you scan this code, you will learn more about our work and how we support public health programs across the country to build and support an infrastructure to help people with dementia, families affected by dementia. Next slide. Today's event is part of our regular bi-monthly series of virtual roundtables. And here we highlight the story and work of one state at a time. Today, we'll be hearing from Oklahoma. And we have envisioned and really launched this series as an opportunity, as a space for networking and peer learning among public health agencies and other partners, and with the goal of building a community of practice. Next slide. Today's event, as you can see, is a meeting, and the goal of that is really to allow it to be interactive and a space for you to communicate with one another and share resources and ideas. So please, just a few reminders before we start. Mute yourself and turn your video on while the panelists are speaking. So this will give us a feeling that we are sharing the same space, like we are in virtual space, but so we can know who all is in the room. And I encourage you in Zoom and to display your name and your organization and state so we know where you're joining us from. You should see a Q&A feature at the bottom of your screen to submit your questions as Morgan and her team members speak. And use the chat, on the other hand, to share comments and resources. So that's our conversation sharing space. And the Q&A is for the questions for the speakers. And at the end of this webinar, please, we encourage you to take just a couple minutes to let us know how we did today, what you thought about today's event, and give us ideas for what you would like us to see covered in future events. The recording, the slides, and all of the resources that are shared today by us and by you in the chat will be emailed to all of you within a few days of today's event. Thank you, and next slide. Before we begin, just to give our speakers today an idea who all is here, we're going to ask you to respond to a very quick poll to tell us in what capacity you are attending today's event. And responses are still coming in, so we're just going to give you a few more seconds to answer. Thank you. Oh, great. Great, thank you. I think we can end the poll right now and share the results. I hope you see it on your screen. 40% are bold public health agencies, and so about half are bold and non-bold public health agencies. So we're always happy to see our public health colleagues from across the country join our events. Also, some community organizations, partners of public health departments, and as well as some people living with dementia, caregivers, and clinical professionals. Thank you for responding. Next slide. And today, as I mentioned, we are going to be hearing from our BOLD program in Oklahoma from Morgan Hamilton, who is the program manager of the Healthy Brain, Heart, and Diabetes program at Oklahoma State Department of Health. Next slide. Before I hand it off to Morgan, I just invite you, we show this graphic. Most of you are probably familiar with this, with the 10 essential public health services. And while most of our presenters, usually their work and their team's work touches on all of these, today, Oklahoma's work, we'll be hearing a lot about three of these areas that you see marked here. So as you're listening to Morgan and her team speak, I encourage you to think about these as you come up with your comments, with questions, and your key takeaways. So without further ado, I am going to give it back to you, Morgan, and thank you for being here.
Thank you, Elma. It's great to see everyone today. As she said, I'm Morgan Hamilton. I'm the Healthy Brain, Heart, and Diabetes, and also Tobacco Program Manager. And I sit here at the Oklahoma State Department of Health, and we're based in the Chronic Disease Prevention Service Department. Next slide, please. So today I'm going to give you guys a brief overview of Oklahoma, give you an overview of our Oklahoma tribes, our Oklahoma Healthy Brain Initiative, which is our BOLD program, some challenges and successes we've had in particular with working with tribes, a little bit about our Dementia Friendly Oklahoma program, and some future projects that we have going in the works with some of our tribal partners. Next slide, please. So this is the lovely state of Oklahoma, and we are around 4 million in population. 16.6% are age 65 and over, and the number of older Oklahomans is projected to increase by 21.3% by 2034. And so we are currently doing our multi-sector plan on aging here in Oklahoma, and I am on our advisory committee for that, and so excited to see some of the work that we're doing with our BOLD program kind of seeping into our NPA here in Oklahoma. In Oklahoma, we have 77 counties, 59 are considered rural counties. On this map, you'll see them in different colors. So each of the colors are the districts for our state health department, county health departments. We have 10 districts total. However, we do have 2 counties in Oklahoma, Oklahoma County and Tulsa County, which are our 2 metros that are independent county health departments. So they are not associated directly with our state health department, but we can work with them, and we still do work within those counties. Here in Oklahoma, our caregivers are 61% women. 20% are 65 years 20% are 65 years older, 35% care for a parent or a parent-in-law, and 8% are shown to be providing care to someone with dementia in Oklahoma. We have 177,000 caregivers, and we have around 76,000 people living with dementia here in Oklahoma. Not all of our county health departments not all of our counties have a county health department. So you'll see we have 6 that do not, but we have some of our counties that have multiple locations. And so we have around 82 county health department locations, so sites, but we only have 68 county health departments that the health department oversees, and 70 if you include Oklahoma and Tulsa County. Next slide, please. So here in Oklahoma, we have 38 federally recognized tribes, and this is the biggest I can make the map to where it wasn't going to be really blurry for everybody. But as you can see, the majority of Oklahoma is covered by tribal land. We have, even in the area that is white, that is not necessarily showing, we do know that we have tribal members that are living in those areas of Oklahoma. The Panhandle is very rural, so there's not a whole lot of population that's living in our Panhandle. But one of my questions for you guys is, do you guys work with the tribes in your state? And I was just curious to see how many do, so you can just put it in the chat or give a thumbs up. Curious if you guys are able to work with the tribes in your state. Okay. We have, Carmen, we understand that is one of the challenges. We'll go to the next slide, please. So just a little bit about did we skip a slide or did we go forward? Okay, yeah, there we go. So this is just the timeline of our program. So in September 2020, we received Component 1 funding, which was 3-year, and it was all infrastructure building at that time. I know Component 2 is a little different now. In April of 2021, the program manager or myself was hired. And in June 2021 is when our Oklahoma Healthy Brain Initiative Coalition began. That's when we started meeting with all of the stakeholders across the state, trying to build a coalition, because in Oklahoma, we did not have an Alzheimer's and related dementia coalition. In August of 2021, our coalition work groups began meeting, and you'll hear a little bit about those in just a minute. And then all through 2022, our work groups spent their time bi-monthly and in between really working on creating our ADRD state plan goals and objectives. We had a state plan in Oklahoma and it ended in 2022. And so our coalition decided to start from scratch and build a new one versus just updating the one we had, since it was already ending. And so we started our new ADRD state plan, and that was launched in June 2023, because we wanted to launch it during Alzheimer's and Brain Awareness Month, which also is when we launched our Dementia Friendly Oklahoma program. And then in September of 2023, we received the BOLD Component 2 funding, and we're able to hire our program coordinator. If you've ever worked with Jacob Guinan, he is our program coordinator here in Oklahoma. And then in August 2024, Jacob was trained and certified as a Second Wind Dreams virtual dementia tour, so that we would be able to bring the VDT to Oklahoma and to more Oklahomans. And he was specially trained in the hospital version, not just, he stayed that extra day to be trained to be able to do it for hospital staff as well. Next slide, please. So just a little bit about our program. Our coalition was based to create and work on the ADRD state plan and to make sure that our state plan is a success. It's great to build a state plan, but we have to make sure that it's successful. And so we wanted to make sure that we were bringing stakeholders to the group that were going to be able to assist us in working on it throughout the years, even if our BOLD funding ended. And we currently have 75 members and partner organizations and individuals. So we offer 2 tiers to our coalition. We have members, which are required to attend meetings and make sure that they are a part of the discussion and everything that we do. And then we have partners that are very invested in it, but don't have the time to necessarily attend the quarterly and bi-monthly work group meetings, but they attend as they can, and they still want to receive communication what's happening and be able to share that information out across the state. And so we have offered a 2-tiered option to be a part of our coalition. We have 5 work groups that cover the 4 topics of the Healthy Brain Initiative Roadmap. So we've got the public education, workforce development, data and surveillance, policy development. And then when we launched our Dementia Friendly program, we created a work group for Dementia Friendly Oklahoma to help us make sure that we were creating a program that was going to fit the needs of Oklahomans, but also it was giving us a team that can help us spread it across the state, as well as help us to reinvent and update it as we go along to make sure that we're still meeting the needs of, that's necessary. Our coalition, the vision is to advance brain health in Oklahoma, and their mission is to promote a system of collaboration among Oklahoma Healthy Brain Initiative stakeholders. When we first started our coalition, we realized there was a lot of silos, which I know many of us would agree that there are silos working, especially just in the senior realm of work in our state. And so we wanted to make sure that we were bringing everyone together and really collaborating versus doing the same programs, but doing them differently and separately. And now I feel that we have actually really brought a bunch of the groups and stakeholders together to where now we work more together, where we can refer out to someone instead of reinventing the wheel and creating our own presentation. We can refer out to organizations and say, hey, they have a great presentation here, let's get you connected, versus trying to create something that's already there. And that was happening a lot in our state. Through our program, our OHBI program here at the State Health Department, we offer educational programs, and we partner heavily with the Alzheimer's Association here in Oklahoma and the Oklahoma Healthy Aging Initiative, which is also in tandem. And I know I saw Keith was on here, so please correct me if I am misspeaking on this, Keith, but the Oklahoma Healthy Aging Initiative is also a part of our GWEP, so our Oklahoma Dementia Care Network. And they are 100% focused on Alzheimer's and dementia here in our state, is how what our GWET decided to do. And so we work very, very closely with OHI, the Oklahoma Dementia Care Network, and the Alzheimer's Association to make sure that we're offering educational programs across the state. My team is a team of me and Jacob. So we rely heavily to make sure that we can get things pushed across as much as possible. We are really excited that we are going to be offering dementia dialogues. I know Ohio and Jacob were just trained on Tuesday to be able to offer this new program out of South Carolina here in Oklahoma. We are going to be, we offer Savvy Caregiver. We're going to be working in tandem with Ohio to help fund their training so that they can help offer the Savvy Caregiver series here in Oklahoma. And then Jacob, like I said, was trained in the Second Wind Virtual Dreams Dementia Tour to be able to offer it at the community level and the hospital level. And we're also very excited to say that our GWEP has sent some folks to be trained as well. And so they can help offer it at the nursing home level and community level as well. So it's another great partnership that if we aren't available, we know that there's someone else that we can refer out to see if we can make sure that that training, that empathy training is available. Then we have our Dementia Friendly Oklahoma Recognition Program, which we offered the Dementia Friendly Work at Health training. And then we're always here for technical assistance, and we offer collateral materials. Next slide, please. And you guys will get to, there's a link to our webpage on that last slide. So when you have the slides, you can get to our webpage to see any of our collateral and everything. But the biggest thing today that Elma and Ashley and I kind of talked about was our work that we've done with the tribes over the last few years. And so we are technically in, I guess, year 5 of we're year 2 of year 5 of our current funding, but this is our 5th year of working with BOLD funding. And so we are finally in the implementation phase. But even in that first component, it was all about trying to get connected to the right person. And we tried for 3 years to make sure, try to find the right person at the different tribes. And it was really hard. And even at the beginning, I tried to get connected to the Southern Plains Tribal Health Board, which you guys will hear about. And we were getting connected, but it was never to the right person. They were always, it's great what you're doing, this is awesome, but they didn't necessarily have someone that they could connect me with that was doing Alzheimer's and dementia work that they felt would move the needle forward. So that has always been one of our biggest challenges. The second one is the political climate here in Oklahoma. What comes out of our state capital does affect, unfortunately, what we can do. And it can cause or has caused some issues of trust with state agencies because we are a state government agency. So we are tied to what goes down at our capital. And so there is some mistrust there amongst us and the tribes, and it can be a hard barrier to break. And data sharing is a big part of that. Is some of them may really want to work with you, but they don't want to share their data because they don't want that information. They don't know what we're going to do with it. And so we have to be really cautious when we have those conversations and making sure that we are letting them know exactly what we're going to use the data for, letting them know we don't want PHI and how we want it, and working with folks to make sure that we're using it in the appropriate manner, that it makes them feel comfortable to be doing that stuff with us. And the biggest thing I've heard as a challenge is funding and or capacity. So in the first 3 years specifically, I kept sharing the HBI roadmap for Indian country with any tribal member that I could see and say, hey, how could we partner with you guys to help make this work? And all of them would say, well, we don't have the funding, or we don't have a program for Alzheimer's and dementia to really take this on. Or even if I have the funding, I don't necessarily have the capacity. I don't have a staff person that I could put on this project. And during the first 3 years of our component 1 funding, I was the only staff person. So I didn't have the capacity to go out and do it individually with all the tribes either. And so it was great being able to share it and share funding information with them, but they weren't actually able to do much with it, it felt like, at the time. However, things have changed in the last year, and we have really hit some strides with making some great connections with some of our tribal members. And I will say some of them were it just happened. It was meant to be. They reached out to us, or they heard about us through something, and that's how we got connected, which is always a good way to do it because it just kind of falls in your lap and it's a wonderful opportunity. But I had Jacob and then our GA for our external evaluator. They did a conference. They submitted an abstract at our Southern Plains Tribal Health Board conference. And the Southern Plains Tribal Health Board, they work with all 38 federally recognized tribes here in Oklahoma. So all 38 tribes are a part of their health board. And they did a great presentation on our general public survey. And we had multiple tribes that were really interested on having that presentation brought to the tribes themselves. And so Jacob and Ann did multiple presentations for individual tribes on that survey, which that's a big, hopefully that will be a really important factor with the new future project that we'll be doing, because they were so interested in learning about just Oklahoma general data. However, when we really looked, and this is Elma and Ashley and I were talking about it because I presented on our survey at APHA, and that's kind of how we got this conversation started for the roundtable. There wasn't a whole lot of data specific to the tribes for American Indian and on our survey. And so we were kind of surprised by that. And so we knew that we needed to do some surveying of our tribes in general. However, their presentation, I'll come back to the survey in a minute, but their presentation got us connected more with the absentee Shawnee tribe, specifically their healthcare. And so they went and did a presentation there. And then we are working and having conversations with them to see if we can potentially do some work with them and the GWEP to try and get more screenings happening in their healthcare system, them getting more data regards to anyone that might be living with Alzheimer's and dementia or caregivers. as well as hopefully getting them trained as a dementia-friendly Oklahoma partner. And so having them have a little more extra training in there and maybe some caregiver training. And then the Seminole Nation, they reached out to us again because they heard of Jacob and Ann doing their presentation at the Southern Plain Tribal Health Board Conference, and they wanted to learn more about dementia friendly. And so we actually went, they are the first tribe that we have trained and recognized as a dementia friendly Oklahoma partner. We attend tribal events as we are requested. And so we have attended some the Cheyenne Arapaho Elders event, the IHS-CHW conference here in Oklahoma, and a few others that we knew that there was going to be tribal representation. We also work with our tribal liaison here at the State Health Department, and he has our collateral materials. So whenever he is invited to health events, health fair events or anything of the tribes, he'll go out and take our collateral with him so that that information is getting out there. Specific to tribes, we printed some of the IA squared materials. And so that's what we hand out in regards to for the tribes. The absentee Shawnee tribe in Oklahoma has a great program. It's the Alzheimer's Disease Program Initiative called Seeking Hope. And so we are working at ways and figuring out how to collaborate with them and see what we can do to help push their program, as well as seeing if maybe we can have other tribes be interested. They do have Alzheimer's funding. And so seeing if we can help them or other tribes maybe mimic things that they're doing that's working well. And they offer the Savvy Caregiver for Indian Country at the absentee Shawnee tribe, which is a free program. So it's unlike the typical Savvy. The Savvy Caregiver for Indian Country is a free program that anyone can be trained in. And it's more of a one-on-one. So you go into the home of the caregiver and the person with the disease and have that one-on-one family conversation versus a community event where you're inviting multiple people to come to. So it's very personal on the Savvy Caregiver side. Next slide, please. So one of the questions we really wanted to ask is, have any of you had any trust or regulatory issues in working with tribes in your state?
And this is so great. Thank you so much, Morgan. I'm really looking forward to hearing what other health departments have done to collaborate or to support tribal health departments. And feel free to raise your hand, write in the chat. This is supposed to be our shared space, so please don't hesitate to speak up.
And Christy, I see your comment that you're trying and building relationships. Relationships is the first start. You have to start with your relationships and finding that person that has an interest and wants to at least have the conversation with you, because they, even if they're not necessarily maybe the right person at the tribe to talk with, them getting to know more about you and the relationship you're building, you have a better chance of getting connected to the right person to get things that are going, because it's all about that trust.
Mm-hmm. Something you said, you mentioned earlier, Morgan, as folks are maybe putting their thoughts together or typing out the tribal liaison in your health department. I wonder, does every health department have a tribal liaison, or do most do? Maybe those of you in the audience, can you say if you know if your department has one or not? I'm just curious. I don't know if that's a position in every.
That's a great question, Alma. I just assumed we all had one, but we may not.
Yeah. So please, if you don't mind, in the chat or say it out loud and tell us if you have one, if you know if your health department has one. Christy Russell. We have an Indian Health Advisory Board that we need to go through to work with the tribes. Each tribe is represented on the board. Okay.
Heather, the question was, do you have a tribal liaison within your organization to work with to make those connections to tribes? Monica, we have two. So we understand, and that's part of the thing too, is they are really, if there's only one or two and they're getting questions and trying to get connections from all the different programs, it can get very cumbersome because they're just shooting out requests, left and right. But we got lucky, and our tribal liaison also sits in on our coalition. So one of our tribal liaisons can share information. When I first started it, I looked internally at the health department of who we needed to have at the table on the coalition, and they were one that we needed. And so they have been on the coalitions from the very beginning. And so they know exactly what we have available to share with the tribes and try to make connections that we can.
Yeah, not everybody knows. It sounds like if they have a tribal liaison, might be something good to find out, especially as we think how public health departments, local, state can work. And
Yeah,
support,
and as you guys saw our map of Oklahoma, we have to have tribal liaison at the state health department just so that we can get connected as much as possible.
Yeah.
Next slide. So I wanted to talk to you guys a little bit about our Dementia Friendly Oklahoma program. We are a part of the statewide network of Dementia Friendly America. And so I am the state lead for Oklahoma. This is a program that we launched in June of 2023. I am proud to say that in just a little over a year, we have 101 partners that currently span all 77 of our counties. So we have at least one partner in every county. That is partially because we were able to train all of our state health department, county health departments in 2024. We were able to train all 68 counties, which is 82 locations. I can't even tell you how many staff. That would be probably hundreds because each district has a various number, but we're really excited to say that all of our county health department counties have been recognized as a Dementia Friendly Oklahoma partner. We have trained 3 of our rural hospitals are recognized as partners, and that has happened in the last 2 or 3 months. And then, as I had said earlier, we have trained 1 tribal nation, and that's the Seminole Nation. And so this program, what it's focused on is originally the picture you see up there of that image. Those were our basic, that was what we wanted to target to start with this program. We wanted to hit businesses and organizations, campuses, restaurants, faith organizations, and communities, towns, and cities. Because we have a program called Certified Healthy Oklahoma, which certifies businesses and organizations in being healthy. The whole goal, and there's tiers. So, do you have a tobacco policy? Do you offer benefits? Just all sorts of things. And Dementia Friendly Oklahoma is now a criteria that people can say, yes, we're a Dementia Friendly Oklahoma partner. And that could pay, if they're like 1 point away, that could push them up a tier. So we're really excited, but we wanted to be on those 5 applications. However, our program has expanded. We do medical, we do clinics. So we do pretty much anyone that would like some training. That's what we're here to do. And so we do require the Dementia Friendly Work at Health training, and they have to train the majority of their staff. We didn't put a percentage on it. But we said majority because some people we know on vacation, they've got sick, maybe they're a caregiver and can't attend. And so our whole goal is to make sure that they get the 10 warning signs, they get some information on communication, and then we talk about the dementia friendly space. We want to talk about their physical space and make sure that someone could bring their loved one with them, whether they're in a walker, a wheelchair, they've got a cane, they can easily get around, they can read, they understand where to go. The lighting is okay, and it's not, they're not going to see shadows on the floor and think it's a hole in the floor and not feel comfortable continuing walking in that space. Making sure that, do they have hearing aids, or do they have magnifiers? So for those that are hard of vision, that they can easily get a magnifying glass to read the fine print of something they're being asked to read at a business. We talk about all of these. We talk about memory cafes. But the ultimate goal of Dementia Friendly Oklahoma is to create a safe and inclusive Oklahoma for those living with dementia and their caregivers. We want to make sure that people feel comfortable going out into the businesses, organizations, and just within their community in general, and continue to have a good quality of life. And so this is one of our, I would say, probably bigger caregiver. It's not just for caregivers, it's for the general public, because we want to do basic education and awareness on Alzheimer's and dementia and break that stigma, but it's to hopefully increase the quality of life of a caregiver so that they feel comfortable to go out and do things and run their errands, go to their doctor's appointment. You know, they can go to our county health department and get their vaccinations, knowing that our county health department staff have been trained. We've talked about quiet areas. So if their loved one is overwhelmed or confused, that there's a spot for them to go so that they don't have to leave, but there's a place for their loved one to calm down when they're overwhelmed and they're wanting to like leave. And so those are things that we do. But the biggest thing is we provide technical assistance. So we go in, we do the training, and then we offer to do community education. We partner with the Alzheimer's Association and OHI to do community educational series so they can then invite folks from the community to come in and hear about these things. So it's not just what happens in their building, but we want to take what happens in their business and organization and their walls and take it out into the community. Make sure we're really breaking that stigma. And then we provide resources. So we do have that statewide coalition of 75 members and partners. And so if someone's looking for a resource, we have a way to see if we can find a resource to share with them, connecting them to legal aid, to the AAAs, to lifespan respite grants, making sure that they are aware of what's in their area. And we've, over a few years, we have had some of our coalition members that said, you know, we're not in that area, but it's not that far out of our range that I think we could help that patient. And then before you know it, now they've got an office in that area. They're like, you know, that's right. You know, we should expand. And so it's been nice to be able to see that and share resources. And so our coalition has really helped. And we're excited to have our dementia friendly Oklahoma partners grow and expand so that we can really get things out there and available. Next slide, please. So our future projects, really excited to talk about our future projects. And I know Leslie Ballinger, I think you are answering things in the chat because I see your name popping up. So feel free to unmute and share information on this if you'd like. Leslie Ballinger is our external evaluator with the University of Oklahoma Health Science Center. And so we are going to be doing a tribal survey, and we're very excited. We are going to be revamping our general public survey that we did in 2022. I can't remember years, Leslie.
2023.
Yes, 2023. And so we're very excited that we're going to be revamping that, but we're going to contract with the Southern Plains Tribal Health Board to make sure that the survey is culturally competent, as well as do the dissemination, the creation, and even the analytics. And so they are going to be helping us focus on these three areas: Alzheimer's disease and dementia awareness, general health questions, and health behaviors, and making sure that what we're asking is culturally competent and it fits for the needs of the tribes. Do you have anything you want to add, Leslie?
Just with that cultural component, we kind of worked with the tribal health board. They're actually going to create, it's not really an advisory board, but they're creating some leaders that are going to work on the survey to repurpose the language. So like Morgan said, it's culturally appropriate. And so they're going to kind of go through the survey that we'd had established, you know, and tailor it so that it's culturally appropriate for the tribes they're serving. And so I think that's really neat that we're having that. I think there's going to be like 3 to 5 that are going to be working on that survey.
Yeah, and so we're really excited, and they're going to help get us, you know, they know about all the events that are happening in the tribes. And so they are actually going to go boots on the ground with iPads and computers and do the survey in person with all of the, you know, at these events, at powwows, at health affairs, at any other event that the tribes might be hosting that they know about and are invited to. And then they can potentially be, if they feel like they need to get our survey responses, they will subcontract with Sooner Survey to do some telephone surveys to make sure that we get a good sample size.
Right. So I think with both those, reaching out individually in person at the events and then having the component of the phone surveys, that'll be great. I think we'll have a good response rate. So we're very excited about the tribal survey. Like Morgan said, it'll be in the spring of 2025.
Yeah, and this is something that we've tried over the last 2 years, working individually with individual tribes. I've gone to individual tribes and spoken to their health boards and said, we would love to work with you on a survey for your tribal members, and you guys could be at the forefront of this and help us build this, and then we can replicate with other tribes and see, how it works. And it never got anywhere.
Hmm.
And
Can I
so
ask a
we're
question,
excited.
Morgan?
Yeah.
Oh, I'm sorry, I thought you were done.
No, go ahead.
A little bit of a delay. Regarding the survey earlier, you spoke to the concern that often about round data. That often comes up, right? And how did the Southern Plains Tribal Health Board and then the tribes accept to provide this data? How will they use it? How will it benefit them later?
That's the exciting part about us working with Southern Plains Tribal Health Board is we are not going to be the houser of the data. So they are the ones that are going to be collecting the data. They will be the ones that will be doing the full analytics and everything. And so we will receive a report, but it will be an aggregated report. So we won't have any information of any tribal member. And Leslie, remind me if I'm remembering correctly, but I don't even think it will be narrowed down by tribe.
Definitely not. It won't be narrowed down by tribe.
So
yeah.
So we won't even be able to pinpoint that this data is regards to that tribe. So when we are doing our full report, or if we do a poster in the future on anything, we won't be calling out any one specific tribe. It will just be, this is what we learned from our tribal data. And so it's a little more, it's not right at one tribe or another. It's a more general tribal survey.
Yeah, makes sense. But the tribes themselves will be able to get access to their individual tribe.
They should from the Southern
right?
Plains Tribal Health Board.
Okay. Thank you for clarifying. This is
and I'm sure
yes,
we're not even gonna have the data by, like we said, by tribe or geographical area. Since when you saw the map, then you could see tribal specific areas. So we won't even have it broken down by that.
We're trying to be very cognizant of the fact that that data sharing trust. And so we just want to see how we can best help them. And so we're hoping by seeing some of the results of the survey, we can say, hey, did you know there's this program that we would love to work with you to promote this among all tribes and offer this as a webinar, so that we saw that this was a need. Or, hey, I see you guys see this as a needed resource, but did you guys know this existed and it's available for tribal members as well? So it's more of a knowledge of how we can connect the tribes with things that might already exist, or help them create things that aren't out there so that they have them available. It's just one kind of foot in the door to help them as much as possible and as much as we can. So on the other future projects, we're really excited about Dementia Friendly Oklahoma. Our goal is to have double the amount of partners that we have had by summer. So we're hoping for at least 120, which we're on the right path to hit that by summer of 2025. But we are hoping to continue training other tribes. We've been in talk with the absentee Shawnee tribe and some others, trying to get in with them and get, talk to the right person so that we can hopefully get them trained. And then we have the Southern Plains Tribal Health Board does a conference every year, and that says 2024, but it should say 2025. We have already submitted an abstract to talk about our program and programs that we can offer Dementia Friendly Oklahoma to speak at that conference. Hopefully we'll be picked as an abstract again, so that we can have an oral presentation at that conference. Some future projects that we have caregiver wise, very excited to say, I didn't put this in my slides, but I was telling Elma and Ashley about it earlier. Our public education work group has been working on a caregiver toolkit, and they've been taking from toolkits from all over that they have found. So what the Bold Center of Excellence has created, what they've found from the Alzheimer's Association, and they're trying to build one that is more Oklahoma tailored. And so we're very excited that should be sent to our Office of Communications to do final edits and everything very soon. and be able to be available for us to provide to caregivers. We're going to have it available on our website. We just don't have a whole lot of printing costs, and we don't want, providers to feel like they have to print it. But we are going to do like little business cards or postcards that have URL links and QR codes, so that a provider could hand that out and someone could put it in their wallet or their purse easily and be able to easily access the caregiver toolkit from anywhere, whether they're at home or they're on their phone and they just are looking for a resource or trying to just read about Alzheimer's and dementia or what's available in Oklahoma. And then I'm real excited, our caregiver with our workforce development program, our work group created this, and I'll put it, I'm hoping it will link. I don't know if it will or not. But they created a notes for the doctor's appointment. And so it's a document that a caregiver can fill out and take it with them to their loved one's doctor's appointment. So it's just a place for them to take notes, and we give them things to consider for that topic specifically, so that they can have that open conversation, because we all know things happen between one doctor's appointment and the next, and we get to the doctor and they say, well, what's happened in the last month? And we go, a lot. But we can't necessarily pinpoint sometimes what it is because we're put on the spot. And so we created this document for them to be able to write that down and take it with them. They could also hand it to the front desk to give to the nurse beforehand if they don't want their loved one to know that they brought that with them and that those are things they want to discuss. So it's just something that's available for the caregiver to utilize. Next slide, please. And so now it's time for questions. If you guys have any questions, we would love to answer anything. I put my work email on there, but I also put our team email on here, thehealthybrain@health.ok.gov. Feel free to email that email as well. Jacob and I both watch that email address. So we'd love to connect with other states on tribal work, on caregiver work, talk about what we're doing here in Oklahoma. Those are probably some of my most fun meetings, is learning what other states are doing and seeing how we can replicate or figure out how to fit it in with what we're doing. I know Heather Carter, I saw, was on the call. I meet with her on a regular basis just so we can do a touch base. Like, hey, are you guys doing anything new? Just so that we can have that conversation. We also, I did almost forget to add, so we do work very closely with our GWEP, and our GWEP offers, they created a CHW, so community health worker, community health representative, dementia specific training. And so we love to connect folks to them. I actually connected 2 states to them yesterday from another bold meeting that we were on. Love to connect if you guys are looking for dementia specific training on either replicating or just talking with them to see how they created it or what their training looks like. But we love to really promote and work with them on the programs and services that they have. And actually Keith just put the GWEP's email in the chat, so feel free to reach out to them directly if you're interested in that CHW training. Thanks, Keith.
Well, thank you, Morgan. Great presentation. An impressive amount of work that's happening in Oklahoma. Thank you so much for sharing. I can think of a couple of questions that I myself have, but I'm going to let the audience and who joined us today see what questions they might have or might other work with collaborations with tribes in their jurisdiction, in their state, that they would like to maybe share.
I put our website in the chat. That will also take you, if you look, you can see and learn more about our coalition as well as Dementia Friendly Oklahoma there, see some of the resources that we have. But like I said, we love to partner and talk with others about what you guys are doing. So please.
Our phone connected.
Let us know if you would like to learn more or if you guys can teach us something. I'm always up to being taught something new.
There were a couple of questions in the chat, and I must apologize. in our Zoom, we don't have the Q&A enabled, so I'm sorry I said that at the beginning that we would, and I hadn't realized that before. So some of you have put your questions in the chat, which is great. Thank you. There was one earlier that actually Heather Carter from North Carolina asked, saying we have a tribe that is not federally recognized, but is state recognized. Do any other states here have this situation? I personally don't even know what this means in terms of collaborating with the tribal health agency, whether a tribe is federally or state recognized, but anybody who can shed some light on that or help me answer, that'd be great.
That's something I'd have to look into, Heather. Most of like the Southern Plains Tribal Health Board, they're working with the federally recognized. Leslie, you may know, but we may have state recognized that I'm just unaware of. And so that's something that I need to look into.
Off the top of my head, I can't remember, Morgan. I'm sorry.
No, you're fine. I can't remember either.
I don't
So.
think so, but well, actually, it might be one. It might be of 39. So yeah, I'll double check.
Yeah, so we do have one that, like I said, is state recognized but not federally recognized. But it's a fairly good sized group of people. So you know, trying to make a connection there. I didn't know if you all had any, and I do know some people personally who are a member of that state recognized tribe, but didn't know if anyone else had any thoughts or ideas.
I do have a follow-up question related to the GWEP's work, which by the way, we did feature the Oklahoma GWEP last year in a webinar, and their work to develop a dementia-specific training curriculum for CHWs. And our 3 public health centers of excellence are actually looking at that as a key point of reference as we support the development of what we hope will be a proposed national core curriculum for dementia for community health workers together with other CDC grantees. But I was going to ask you, do you collaborate also with CHRs, the community health representatives? They are the CHW, their type of CHW role, working specifically with tribal nations in your efforts or in
So
your
us
tribes.
In Oklahoma. So the GWEP they do their training is also, it's open to the CHRs. And Keith, I don't know if you're able to come off mute if you want to say something about that, but they do offer their dementia specific training to CHRs and CHWs.
Smartphone connected.
And I know, you guys do something with IHS, correct?
Yeah, so actually, was that Elma that asked that question?
Yes.
Yeah, okay, hey, sorry, I'm a real human, not just a black screen, so I've been just kind of here. Yes, so the colleague that developed this, Dr. Kirsten Reinschmidt, is in the College of Public Health, and she has delivered this actually to mostly CHRs. That has been the primary audience because she got major traction with IHS. I mean, I was on one of her trainings, I believe it was last December, and it was broken into 2 days, December and January, to like 100 people that were all over the place, New Mexico, Arizona, California, you know, you name it. So they really like this training. They find it very, and she's an anthropologist. We're both actually anthropologists, so she's very culturally sensitive with the way she delivers it. So she has another couple coming up. If you email us at like the okdcn@ouhsc.edu, I could send you more info or have my project officer manager send you more info. But we've had a lot of uptake with tribes for this for sure. But we've definitely done it for CHWs as well. But we've just had this really good interest from CHRs.
Well, that's great. Thank you, Keith. And it was Dr. Reinschmidt who was at the webinar last year sharing your work, and it was great to have her. But I didn't know it was mainly CHRs. So that's That's
I don't know if I would
good
say
point.
it's more than 50% CHRs. It may be 55,
Wonderful.
60% of the people she's trained. So she's definitely reached a lot of CHWs, but it's been a chunk of people that are associated with IHS who have, the IHS people love it. They really like this training, and they would like a lot of the CHRs to take it. So yeah, I mean, if you know Kirsten, you could reach out to her directly. She'll tell you.
Yeah, great. There was another question. There was a couple more questions in the chat. Mr. Michael Ellenbogen asked, are there any of the states here that represented that have mandatory dementia training for hospital staff? That's a good question.
Not that I'm aware of. In Oklahoma.
Hmm.
It would be nice. It would be a nice in to all those hospitals for training.
Yeah, I would imagine different professional associations would have that as part of at least continuing education curriculum in their state, but let's see.
I would say we have found that our rural hospitals have been more interested in this training because they're hungry for training and education and for folks to be willing to go out to them and do the training. And so they've been very interested. We Jacob presented at the Rural Rural Hospital Association conference about dementia friendly, and that's kind of why we've gotten connected with some of our rural hospitals. But we're doing it too, that if they want the virtual dementia training, so the hospital piece has a fee to it if you want it as a hospital. And so we've actually put like scholarship funds in our bold budget so that we can pay for the rural hospitals to have the virtual dementia training, but we're requiring that they be a Dementia Friendly Oklahoma partner for us to pay the fee so that they can get that basic 10 warning signs, communication, and physical space training before we go in and do the empathy training.
I see.
And that was a request of our project officer to use the funds that way.
Have you utilized the ECHO model for training in rural areas in Oklahoma?
Through our GWEP. We partner very closely. We work very closely with our GWEP, and they do the ECHO, but we are working with the Alzheimer's Association and Bold Center of Excellence to offer a project ECHO for our county health department staff on risk reduction. That's the next project ECHO that we're doing. We're doing that in the spring.
And another question from Mitsuoto Mita is, dementia is a common cause of death and much feared. How do you provide information regarding advanced care planning from your Oklahoma Department of Health perspective?
So I'll be honest, and we haven't necessarily tackled that right away. As Leslie put, we did ask in our population survey some questions and did find that 1 of 4 were very worried about developing dementia. And so we are focusing on a risk reduction marketing campaign in 2025 to talk about brain health and heart health and how diabetes, sleep, hearing, the Lancet risk reduction, modifiable risk factors is kind of what we're focusing our campaign on to hopefully, but to talk, we haven't really talked about advanced care planning at this point.
Okay.
We've had presentations for the coalition on the difference between palliative care, hospice care for our coalition members, but we haven't necessarily done education for the public.
Our center on our resource hub, we have a toolkit, which is really a repository of resources related to advanced care planning. And it's, while it is intended for use by families and community members, also public health departments can use it and disseminate it as well. Has a lot of useful links. So you may want to look at that as well.
Yeah, I'll have to look at that. Like I said, I haven't seen the caregiver toolkit that the work group has created. They may have something in there on it, but I haven't seen the final version yet. So it could be something in there. Because I know they looked at the toolkit you guys had, Elma, and I do think they brought some in.
Yeah, they might take some or none, or they provide have resources there. That's great. Well, I think we are at time. Thank you so much, Morgan and Leslie, and for sharing today, for presenting for us, and great work. I am glad that you got to share some of your successes, some of the challenges, but also lessons learned for others, for working with tribes in their states, and how they can help build that trust in those relationships. So
My biggest thing is don't give up. If we did, we wouldn't be 5 years and all of a sudden doing, working with the Southern Plains Tribal Health Board on the survey. Just keep trying, keep knocking on doors, sending emails. Someone will respond.
Good. Well, thank you so much for being here today, everybody, for joining us. And if you just have a minute when you leave the Zoom, I think an invitation might pop up for you to take a survey. If not, you can scan this QR code and just on your phone. Now give us feedback about today's session, and also give us your ideas for what you would like to see our center address in future programming. Again, thank you everybody here. Morgan, Leslie, we're very grateful for having you. We will see you again soon, and have relaxing holidays if you celebrate them the rest of this month, everybody. And stay warm.
Thank you. Bye, Alma. Bye, everyone.
Bye.